Hello. Today we start our topic Haemopoisis. And what Haemopoisis? Haemopoisis is a blood forming process. Process of formation of blood, formation of blood, or we can say blood cells. Blood cells. Okay. Now, in Haemopoisis, there is a first common cell which is a pluripotent stem cell. What is pluripotent stem cell? Stem cells is that cell which can further divided into other kinds of cells and differentiate into other kinds of cells. So, first is pluripotent stem cell. Stem cell. This is, and it is further divided into progeny two series cells, that is the myeloid stem cell and lymphoid stem cell. Lymphoid stem cell. This myeloid stem cell form blood cells of myeloid series, and lymphoid stem cell forms the lymphoid series blood cells. Now, first we see myeloid stem cell, how further divided and how the myeloid series blood cells are formed. So, this is the stem cell. This is first divided into myeloid stem cell. Then it forms the first progenitor cell, that is the colony forming unit erythrocyte. This is the colony forming unit erythrocyte. Then it forms precursor cells, that is the proerythroblast. Proerythroblast. This is a precursor cell, and in this is a formation of RBC. So, colony forming unit erythrocyte, then precursor cell proerythroblast. In this, a small amount of hemoglobin is present, and then it is further divided into reticulocyte. Reticulocyte. Here, nucleus is eject out, and all the cell organelles will disappear gradually. The hemoglobin will increase, and in this only remain some RNA amount in the form of network is remains here. Now, this reticulocytes is divided into the RBC or erythrocyte. RBC or erythrocyte. Now, this whole process from stem cell to RBC, this requires about 7 days. This requires about 7 days. In reticulocyte, at this stage, some maturation factor is required. Maturation factor is vitamin B12 and folic acid. Folic acid are also B. Now, if this maturation factors are not present, then it results into the megaloblastic anemia. In this, megaloblasts are formed which are fragile, and its lifespan is less than the normal RBC. It is about 40 to 50 days, and normal RBC lifespan is about 120 days. So, in this, anemic condition happens if there is a deficiency of maturation factor, that is vitamin B12 and folic acid. So, in this way, RBC is formed. Next is, now, this myeloid series stem cell divided into colony forming unit, megakaryocytes. Megakaryocyte, then megakaryoblast is formed. Megakaryoblast, megakaryoblast is formed. This is also the precursor cell. And then megakaryocyte, megakaryocyte is formed. Now, this is the big cell, megakaryocyte. It is further fragment out into the small pieces, and these are known as thrombocyte or platelets. Now, these are broken down into the small pieces, and in this thrombocyte, platelets are formed. Platelets are formed. In this way, the platelet formation takes place. Karyocytes, we see next in this series is eosinophilic myeloblast, which is divided into eosinophils, then these are eosinophils are formed. Now, next is basophilic myeloblast, which forms basophils, which form basophils. Next is, this is further divided into CFUM, GM, that is colony forming unit, granulocyte, macrophages. Its full name, colony forming unit, granulocyte macrophage, which is the progenitor cell. Then it further divided into two, that is myeloblast, and this is monoblast. So this myeloblast converts into neutrophils, and this is monocyte. So we see eosinophils, basophils, and neutrophils. These three are granulocytes, commonly known as granular cells or granulocytes. We can see. Okay. Now, and this monocytes again further divided into, sometimes it is outside the blood cells, blood vessels. It is known as macrophages. So these are the cells will form of the myeloid series, or myeloid stem cells forms these cells. Now we see lymphoid stem cell series. Lymphoid stem cell series. Lymphoid stem cells. In this, three cells are formed, that is T lymphocytes, B lymphocytes, and natural killer cells. First is T lymphoblast is formed. T lymphoblast form, which is divided into T lymphocytes. Second is B lymphoblast is formed. B lymphoblast is formed, which is divided into the B lymphocytes. Now these are again can when it is goes out of the blood vessels, plasma cells formed from the B lymphocytes. And this is next is NK lymphoblast. These forms natural killer cells, NK cells or natural killer cells. So these are the cells which is formed by the lymphoid stem cell series. Now here we complete our the hemophysis process, but we see some of the maturation factor which is required for the RBC maturation. Maturation of RBC factors for RBC maturation. Vitamins. In vitamins, vitamin B12, B12, folic acid or vitamin 9, we can say B6, vitamin B6, pyridoxine and vitamin C. These are the vitamins. Next is minerals. Minerals are zinc, copper, cobalt and iron. Main is iron. These are the vitamins, minerals and one hormone is required, thyroxine hormone, which is released by the thyroid gland. And next is erythropoietin. Erythropoietin, and this is also known as renal erythropoietin factor. Poietin factor, which is also required for the maturation of RBC. This is globulin. This is a glucoambo. In this amino acid, protein chain amino acid, about 124 amino acids and 4 oligosaccharide chains are present, and 4 oligosaccharide chains are present. Oligosaccharide chains present, and in this is required for the maturation of RBC. Sometimes recombinant erythropoietin is used for the clinical treatment of anemia, and erythropoietin increases the erythropoietic sensitive stem cells in the bone marrow. Then how we can increase the RBC number. So this is all for the hemophysis.